Welcome to the Scope Report, discussing changes in the nursing profession in Ontario, where we dive into the evolving world of nursing and what it means for healthcare in our province. From new prescribing power for RNs to shift into professional accountability, we're here to break down the latest updates and what they mean for nurses on the front lines. Today, we're exploring key policy changes and opportunities for shaping the future of nursing in Ontario.
Hey, Kenton, I have some questions regarding the history, need, and rationale for RN prescribing. Would you care to elaborate?
Of course. The history and need for registered nurses to gain prescribing authority is lengthy and multifactorial. In 2017, the Canadian government amended the Nursing Act to enable registered nurses to prescribe medication and communicate a diagnosis to patients with the purpose of prescribing. This did not grant RNs the ability to prescribe. Instead, it laid the foundation for the College of Nurses of Ontario to begin the labor required to enable RNs to prescribe. The CNO in 2017 aimed to ensure that the goal of RN prescribing is achieved safely through surveys, increased competencies, and research before granting RN's prescribing authority. Another important thing to know is the need and rationale. RN prescribing authority came into effect on November 6th. This enabled RNs who are qualified to prescribe certain medications and communicate a diagnosis with patients for the purpose of prescribing. By expanding the RN scope of practice to include prescribing authority, the changes enables the healthcare system to improve access to certain medications and treatment options. Catriona Mill, the manager of this practice quality at the CNO, states RN prescribing is a shared milestone for nurses, the healthcare sector, and the public. One of the important needs to reflect on is that RNs have a wealth of medical knowledge that is not being fully utilized. By allowing RNs to further their competencies and knowledge in prescribing, it lessens the burden on the healthcare systems and providing alternative avenues for patients to explore. Angela, can you discuss the benefits and risks to the public regarding RNs receiving prescribing authority, both collectively and individually?
Absolutely. So, research has shown that RN prescribing provides benefits such as faster access to medication, specifically as it relates to treating common conditions and getting access to preventative care. Prescribers stated in the research that we're able to provide a holistic approach and a comprehensive assessment and thorough treatment for each patient. RN prescribing also provided reduced waiting times as they saw this benefit easing as the ease of access for our patients to come and to get everything, as they call it, in a one-stop shop. This essentially also minimized patient costs and easing financial burdens. And the research also found that there was greater continuity of care as patients were seen regularly and they were able to forge a healthy relationship with each patient, and this resulted in improved medication compliance. As per risk, potential for medication error, as some prescribers may potentially practice outside their scope. Some might tend to treat friends or families without proper history taken. And they saw that failure to follow up could also potentially be a risk. Individual risk is each prescriber responsible for decision making, dosing, and monitoring. They were expected to have professional liability protection that as per each risk. As for CNO, nurse prescribers must have authority. This means that they must practice in compliance with their legislative scope and employer policy. In content, they must have the knowledge, the skill, and judgment to prescribe. And finally, in competence, competence speaks to the skill, knowledge, and judgment to provide safe and ethical care in their role as prescribers. That's essentially it for now. Thank you. Hey, Christine, can you discuss the benefits and risks of RN prescribing to the profession of nursing?
Hi, Angela. Great question. Absolutely. So the key benefits of RN prescribing includes an expanded scope of practice, which allows RN to play some more integral role in healthcare teams and provides a greater autonomy in managing patient care. It also improves access to care, especially in rural areas or underserved areas, and helps streamline healthcare delivery by reducing the physician's workload. And additionally, RNs can provide a more patient-centered, sorry, that's my baby, patient-centered care, strengthening relationship with patients and enhancing job satisfaction. Now, some of the potential risks includes increased responsibility and liability for medication-related errors, which could also lead to a personal and professional consequences. There is also the risk of scope of practice confusion, as the expanded role may be blur the lines between nurses and physicians. Now, to balance the benefits and risks, RN prescribing medication must be implemented with clear guidelines. ongoing education, and strong institutional support. This is ensuring that RNs receive an adequate training in pharmacology and clinical decision making in crucial and collaboration with other healthcare providers such as physicians and pharmacists. And this is necessary to prevent fragment care. The approach can help enhance patient care without compromising the safety and integrity of the nursing profession. That's about it for me, Angela. Jevanette, can you talk about the essential training for each individual RNs to be eligible for RN prescribing?
Yeah, to be eligible for RN prescribing, nurses must complete an approved education program at a recognized institution. Schools like McMaster University, Queen's University, Humber College, Georgian College offer specialized programs that focus on safe and ethical prescribing. So these programs ensure that nurses gain the proper knowledge and understanding before they begin prescribing medications. CNO practice standards outline the responsibilities and expectations for RNs when prescribing medications. They provide guidance and on safe prescribing, ethical decision making, and accountability. So, by practicing these standards while in school, RNs can develop strong clinical judgment, learn how to make accurate assessments head to toe, and ensure they're prescribing safely within their scope of practice. Thank you for listening. Jen, what are some quality assurance and information we should know regarding RN prescribing?
So I have some strategies to ensure quality assurance. To improve quality assurance, CN Council approved education for RN prescribing is mandatory. RN who attend this program will gain accountabilities and competencies to prescribe medication. This program will also help RN to integrate health assessment skills and knowledge of pharmacology. Field clinical nursing practice for about 150 hours is also required. Also, RN who prescribe medication need to practice under their own scope, and they need to comply with guidelines and standard from CNO. Like if an incident happened, the RN need to complete an incident report. In this way, like the RN can analyze and reflect the procedure to avoid similar incident in the future. RN who has the authority to prescribe need to recognize when to collaborate, consultate, and transfer of clients' care. To ensure quality assurance, RNs can only prescribe certain types of medications, like any vaccines to prevent viral and bacterial disease, birth control method, including hormonal and intravaginal contraceptives, medications to protect tribal health, like doxycycline, topical wound care cream, and anesthetics for topical wound care, medications to help smoking cessation, and medications to relieve allergic reaction, and some over-the-counter medications. Hi, Paul. I have some questions, like what organizational support are in place for RN prescribing?
Hi, Jane. Thank you for asking. Well, there are three main components for RN prescribing, which is the core for both regulatory expectations and organizational responsibility. And those are authority, competence, and safety, as mentioned before. Now, under the principle of authority, CNO will support the RN prescribing by clearly defining the legal and professional boundary within the RN must operate. This includes enforcing practice standard, regulatory requirement, alignment with employer policies to ensure that RN prescribed safely and appropriately. The CNO also outlined the necessary mechanisms that allowed RN to communicate diagnosis and prescribe medications within the authorized scope. And for competence, the CNO will oversee all the quality and ensure that all the education program approved to equip the RN with skills to assess diagnosis and provide evidence-informed care. Safety is supported by collaborations with other healthcare professionals and access to real-time clinical support. And employers are expected to implement workplace policy that enable safe prescribing practice and provide environment for consultations. The CNO also maintained a public registry for RN authorized to prescribe, enhancing transparency and public trust. There are still a couple of barriers, according to Hutchinson Daniels, that can hinder the effect of implementations of RN prescribing. Many workplace and medical facilities still lack the formal policy or framework, placing all the responsibility on nurses to initiate and manage the process of RN prescribe alone. Outdated or conflicting guidelines, along with unclear role definitions, will also create further confusions. And the inconsistency of the quality for mentorships and peer support, that will cause a lot of inconsistency of the RN prescribing quality between organizations. And this will be a challenging experience for RN prescribers. Now, in the micro perspective, organizations in the future must provide access to clinical support resources such as diagnostics tools, drug reference, and access to other prescribers for consultations. And they need to ensure the quality and maintain the consistency of the mentorships and continue professionals development to maintain competence. In a macro perspective, CNO always will be developing new practice standard and outline the specific responsibility for RN authorized to prescribe. And CNO is creating also new resources and updating the current, reflecting the broader accountability expected of all nurses. Thank you, Jane. And Boris, hi, may I ask, what are the strategy to ensure public safety with RN prescribing?
Hi, Bo. Sure, no problem. Ensuring public safety is central in RN prescribing in Ontario. The CNOs put clear safeguards in place, so RNs are only permitted to prescribe within a specific list of medications for non-complex conditions. They must personally assess and diagnose the client before prescribing, and they're not allowed to delegate that authority either. So in practice, RNs are expected to stay within their individual competence. And if they're uncertain or the situation falls outside of their scope, they're encouraged to consult with other healthcare professionals or refer the client. Clear documentation and adherence to the code of conduct are also key strategies in maintaining accountability and safe prescribing practices. So this change is a pretty big deal in healthcare access and efficiency. By allowing RNs to prescribe, we're helping reduce bottlenecks in the system, especially in primary care, public health, and rural settings where access to physicians or NPs may be very limited. It also means that it's more streamlined. If an RN assesses a client and determines that the medication is appropriate, they can initiate treatment right away without waiting for another provider to step in. So it's really smart use of nursing expertise and helps RNs play a more central role in patient care planning.
Thank you very much.
Now, Angela, can you incorporate authority, content, and competence in RN prescribing?
Absolutely, absolutely. As it relates to authority, it simply means that the nurse must prescribe in compliance with their legislated scope and their employer practices. In relation to content, they must have the knowledge, the skill, and the judgment to prescribe. And competence, it speaks to the ability to practice safely and ethically in their given role and setting. That's basically what that's about. Thank you for asking.
I'm going to discuss how RN prescribing might impact nursing retention. In 2024, Health Canada created a nursing retention toolkit with a focus on enhancing the working lives of nurses in Canada. Changes and increases in the nursing scope of practice with the registered nurses gaining the ability to prescribe opens new career pathways and opportunities. Nursing is recognized for its diverse range of career options and educational opportunities that enable nurses to enhance their competencies. Prescribing power can be seen as a positive and gives registered nurses the option to work with patients in a new profound way. RNs who have the additional competencies discussed early in this presentation are able to treat, medicate, and diagnose patients like never before in Ontario. Gemini, can you discuss how the principles of compassionomics and its impact of RN prescribing?
Yeah. Compassionomics is the integrity of compassion and care in healthcare, emphasizing that providing care goes beyond medical treatment. It involves genuine empathy and connection with patients. It highlights that nursing is not just a profession, but a calling driven by passion. With RN prescribing, compassionomics plays a crucial role in ensuring that prescribing decisions are patient-centered. It means considering not only the clinical aspects of prescribing, but also the patient's emotional, financial, and social well-being. By practicing compassionate prescribing, RNs can improve patient adherence, enhancing trust, and ultimately contribute to better health outcomes.
Great, thank you. End of presentation.